Welcome. In this educational documentary entitled Nigeria's Alarming Excessively High Maternal Mortality, a Crisis Unfolds, we continue our in-depth exploration of Nigeria, focusing on the country's excessively high maternal mortality ratio. Consistent with all our documentaries, our goal is to provide detailed context and thorough analysis to help our viewers all over the world understand the factors driving these statistics. We thank our healthcare contributors for their input to this documentary. Please join us as we uncover key insights and explore solutions to address this critical issue. Don't forget to like, share, and subscribe.
The learning objectives are on your screen. The outline defines maternal mortality ratio, and maternal mortality rate, categorizes these rates by severity, and examines the magnitude of the issue by region, focusing on healthcare personnel density. It explores causes of high maternal mortality in Nigeria, referencing the United Nations Sustainable Development Goal 3.1 and compares rates in Ghana, India, and Nigeria. Contributing factors like the economy and brain drain, JAPA, are highlighted, alongside recommendations to revisit the Abuja Declaration of 2001 and retaining healthcare professionals. In reviewing the data on infant mortality rates in Nigeria, our inquiry extended to the maternal mortality in Nigeria, using data from the World Bank Group. The World Health Organization defines a maternal death as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, excluding accidental or incidental causes. Maternal mortality ratio represent the number of maternal deaths per 100,000 live births. Maternal mortality rate, which is the ratio of maternal deaths to the women years of exposure for the age group 15 to 49. These all provide critical insights into the health challenges and risks faced by pregnant women. For the purposes of comparison between countries and regions, we will focus on the maternal mortality ratio in parts of this video documentary. On your screen is the 2020 World Health Organization country categorization of maternal mortality ratio based on number of deaths per 100,000 live births. All the countries that are listed are in Africa. The categories are low, high, moderate, very high, and extremely high. Let us focus on the red box on your screen. This is the extremely high maternal mortality category that exceed 1,000 deaths per 100,000 live births. Nigeria, with a maternal mortality ratio of 1,047, is in this unenviable category. The two other countries in this category are South Sudan and Chad. There is still a lot of work to be done to reduce this excessively high maternal mortality rate in Nigeria. This graphical illustration highlights the magnitude of maternal deaths by geographic region of the world. The overwhelming majority of these maternal deaths occur in Africa. Unfortunately, as one can observe from the graphic, the number of maternal deaths in the African region has remained relatively unchanged from 1985 to 2020. In contrast, other regions such as Oceania, Europe, North America, South America, and Asia have reported significant reductions in maternal mortality over the same period. The density of doctors, nurses, midwives are very low in Africa. Invariably, a low density of these health professionals has an adverse impact on healthcare delivery and specifically resulting in a high maternal mortality. On your screen is a graphic of density of doctors and nurses, midwives in Africa in 2020. Between 2012 and 2020, the density of doctors was estimated at 2.9 per 10,000 population, while the density of nurses, midwives per 1,000 population was estimated at 1.29 in the same period. In the red box are the data from Nigeria, with less than 5 doctors per 10,000 population and less than 2 nurses, midwives, per 1,000 population. Another factor that can impact maternal mortality is the proportion of births by skilled healthcare personnel. This is a graphic of the proportion of births in 2021 attended by skilled healthcare personnel in Africa. In general, births attended by skilled healthcare personnel are very low in Africa. Nigeria, in red colour on the graphic, has one of the lowest rates, between 0 to 64%. This explains in part the reason for the excessively high maternal mortality in the country. The countries in green, with South Africa as an example, had at least 90% births attended by skilled healthcare personnel. South Africa has a maternal mortality ratio of 126.8 deaths per 100,000 live births as of 2020. Regarding the causes of the excessively high maternal mortality in Nigeria, this graphic illustrates maternal deaths by cause in Nigeria. The major complications, which account for almost 75% of all maternal deaths, are severe hemorrhage, maternal hypertensive disorders such as preeclampsia and eclampsia. Other causes are maternal sepsis and other maternal infections, maternal obstructed labour and uterine rupture, abortion and miscarriage. Most of these are preventable or can be adequately managed with adequately staffed and trained healthcare personnel. In 2015, all United Nations member states adopted the 2030 Agenda for Sustainable Development, which outlines 17 interconnected goals and 169 targets. Among these, Goal 3 aims to ensure healthy lives and promote well-being for people of all ages. This goal is cross-cutting, meaning progress toward it also advances other goals, and vice versa. Actions on other goals support the achievement of Goal 3. Additionally, most goals include specific health-related targets, and all goals have measurable indicators to track progress. Target 3.1 is to reduce global maternal mortality ratio to less than 70 deaths per 100,000 live births by 2030. On your screen are the maternal mortality ratio per 100,000 live births in the African region 2020 compared to 2017. We highlight 2 countries, Ghana and Nigeria. In 2017, Nigeria's maternal mortality ratio was estimated at 917. It increased by nearly 14% in 2020 to reach 1,047 deaths. In 2017, in Ghana, it was 274. It reduced by 4% to 263 by 2020. The numbers are per 100,000 live births. The graph presented on your screen illustrates the trend in maternal mortality ratio from 2000 to 2020 for Nigeria, Ghana, and India, with a focus on the most recent data from 2020. In general, Ghana and India exhibit sustained reductions in maternal mortality ratio. Nigeria's trend shows less progress. This comparative analysis reveals significant disparities. Nigeria recorded the highest rate at 1,047 maternal deaths per 100,000 live births, followed by Ghana with 263 and India with 103. These figures underscore the urgent health challenges faced in these regions, particularly in Nigeria, where the rate far exceeds those of its counterparts. Understanding these trends is crucial for addressing the root causes of maternal mortality and implementing effective health interventions to improve maternal health outcomes. The graph depicting India's progress in reducing maternal mortality ratio from 384 deaths per 100,000 live births in 2000 to 103 deaths per 100,000 live births in 2020 highlights a remarkable public health achievement, representing a 73% reduction over 2 decades. This progress underscores the effectiveness of India's health initiatives aimed at enhancing maternal care. If this trend continues, India is on track to meet the World Health Organization's Sustainable Development Goal 3.1, which aims for fewer than 70 maternal deaths per 100,000 live births by 2030. Achieving this goal would mark a significant milestone for India and set a benchmark for other nations. This analysis demonstrates the potential impact of sustained health interventions and government commitment to public health priorities. The graph on your screen illustrates Ghana's significant progress in reducing its maternal mortality ratio from 499 deaths per 100,000 live births in 2000 to 263 deaths per 100,000 live births in 2020, a 47% reduction over 2 decades. This achievement reflects Ghana's dedication to improving maternal health. However, challenges remain, particularly in meeting the World Health Organization's Sustainable Development Goal 3.1, which aims for fewer than 70 maternal deaths per 100,000 live births by 2030. Achieving this goal requires continued improvements in healthcare infrastructure, access to quality prenatal care, and effective public health strategies. A commitment to advancing maternal health is essential for reaching this international target and enhancing the well-being of mothers nationwide. On your screen is a graph depicting Nigeria's maternal mortality ratio from 2000 to 2020. The graph shows fluctuations, highlighting inconsistencies in addressing this critical issue. During the Obasanjo administration from 1999 to 2007, substantive gains were made in reducing the maternal mortality ratio between 2000 and 2006. These gains were subsequently reversed. Over the last 20 years, there has been a modest 8% reduction from 1,148 to 1,047 maternal deaths per 100,000 live births, roughly 1 in every 100 mothers facing a fatal outcome. This slow progress reflects challenges within Nigeria's healthcare system, worsened by a significant exodus of professionals due to economic hardships, a legacy of the 1980s brain drain and the recent Japa phenomenon. The reduction in Nigeria's maternal mortality ratio from 1,135 in 2018 to 1,047 in 2020 under President Muhammadu Buhari's administration, 2015 to 2023, is highly encouraging. We now await the data from 2021 to 2024 to determine whether his administration succeeded in lowering the maternal mortality ratio below 1,000 deaths per 100,000 live births. Achieving this milestone would be a significant advancement, moving Nigeria from the World Health Organization's country categorization from excessively high category to the very high category, 500 to 999. Such progress would represent a historic achievement as the first substantive impact on maternal mortality by any Nigerian leader. This achievement, if substantiated, cannot be overstated. Maternal mortality ratio units are deaths per 100,000 live births. We hope the current administration of President Bola Tinubu, in office since 2023, at the time of this documentary, continues this progress. Achieving the United Nations Sustainable Development Goal 3.1, which aims for fewer than 70 maternal deaths per 100,000 live births by 2030, may be challenging. However, efforts aimed at reducing the maternal mortality ratio below 500 would be significant, moving Nigeria from the World Health Organization country categorization from very high to high moderate category. 100 to 499. This would mark another historic achievement as the first Nigerian leader to achieve this important milestone. Maternal mortality ratio units are deaths per 100,000 live births. Let us now focus on recommendations to reduce the excessively high maternal mortality in Nigeria. The primary recommendation is to strengthen the health workforce by training and deploying doctors, nurses, midwives, and community health workers nationwide, including at the local level, along with financial incentives to raise skilled birth attendants. Investments should also be made in transport infrastructure and health facilities from local health posts to national hospitals. A systematic program should ensure 24-hour operation of health centres, with added maternity services for better accessibility. The early recognition of high-risk pregnancies and referral to specialist centres. There should be extensive information on family planning programs. Finally, data collection should be improved so priority will be assigned to states with high maternal mortality and high infant mortality rate. Nigeria faces a double whammy of high infant and maternal mortality, driven by a declining economy and severe healthcare brain drain. The Japan phenomenon, where skilled professionals, including doctors and nurses, emigrate in search of better opportunities, exacerbates the healthcare crisis. Poor funding, inadequate infrastructure, and economic austerity measures worsen the situation, leaving under-resourced facilities unable to provide quality care. To address this, Nigeria must increase healthcare funding, improve working conditions for medical professionals, and offer incentives to retain talent. Strengthening healthcare systems and policies will be essential to reversing these alarming trends. In conclusion, Nigeria's excessively high maternal mortality highlight urgent systemic healthcare challenges. The government must urgently ensure that its healthcare budget is consistent with the 2001 Abuja Declaration's goal of allocating 15% of national budgets to healthcare. Additionally, Nigeria should strive to meet the World Health Organization's Sustainable Development Goal 3.1, which aims to reduce maternal deaths to below 70 deaths per 100,000 live births by 2030. To tackle these crises, Nigeria should enhance incentives to retain healthcare professionals, encourage expatriates to return, and foster collaboration with international organizations and non-governmental organizations working to reduce maternal mortality. We wish the Nigerian government and its people the very best of luck as it urgently improves healthcare delivery in the country. The learning objectives showing on your screen have been met. Thank you for watching.
If you enjoyed this video, don't forget to like, share, and subscribe. Your support helps us bring more insightful, informative, and educational content to a wider audience. By subscribing, you ensure you don't miss out on our future videos that delve into fascinating topics from around the world. This video documentary is in collaboration with Apomulero Media LLC.